Hi, everybody. Thanks for coming to our mental health topic today with MedTalks. This is our very first program series for MedTalks, and we'll be introducing 4 other topics in the next coming weeks. My name is Lynn Nguyen, and I'm the Young Adult Librarian at Chinatown Branch Library. I'm here with my co-host, Irving Dang, who is a recent med school graduate. So say hi, Irving. Can you tell everybody about yourself?
Hello, everyone. So my name is Irving Dang. I'm a recent medical school graduate. I'm going to be applying for residency this fall. I'm hoping to get into internal medicine. And I've known Lynn for a while, and we discussed this program that I had in my head, and I'm really excited to get this thing started.
Wonderful, wonderful. So can you tell us a little bit more about what MedTalks is so everybody here is aware?
Yeah, so the goal of MedTalks is designed to educate the general public about a range of issues involving medicine and healthcare. This was inspired in large part due to the current climate and the widespread misinformation that's going around. And the thing is, not only is this tremendously misleading, it can oftentimes be promoting dangerous, unproven treatments and habits that puts your health and lives at risk. And so creating this program was our attempt at fighting this dangerous trend and helping people get the real medical facts out there.
Wonderful. So before we begin with the program, we would like to go over some housekeeping rules. We ask that you keep your microphones muted and your cameras turned off. Recording is in progress. We received an overwhelming number of questions, and we have forwarded that to our guest speaker, Stacy, today, and she'll do her best to answer all of those questions in her presentation. If you feel the need, to ask questions during the program, please do type that in the chat box. Irving and I will do our best to ask those questions for you. We understand that mental health can be a very sensitive subject for many, so please do be respectful of everyone during the program today. Personal views or anything that may be offensive will cause you to be removed from the program. And please remember, there will be 2 very short surveys at the end of the program for you to complete. So I'll turn it over to you, Irving.
Okay, so I would like to introduce our guest speaker, Ms. Stacy Ma Dubois. She is a licensed clinical social worker and mental health clinical supervisor at LA County Department of Mental Health. She attended the University of California, San Diego, where she received her bachelor's majoring in psychology, and she also received a minor in sociology. Afterwards, she obtained her master's in social work from Columbia University in New York.
Hi, everyone.
So Stacy here is passionate about the field of mental health as she sees this impacting everyone and has dedicated the last 10 years enhancing services offered in her program and providing education and awareness on the topic of mental health and stigma. She understands that life's hardships affects an individual's mental health and values the family and community support she has that has helped her through her own personal hardships. Her hobbies include color therapy, listening to a range of music, getting massages, and enjoying peace and quiet, even if it's for 5 minutes. She has 3 young children that she cares for at home.
So Stacy, could you please tell us about some of the clients and patients that you work with?
Sure. So prior to coming to the program that I'm working with now, I've had a extensive history in working with clients in the community, whether they have a developmental disability like autism or a physical disability like cerebral palsy, individuals who have been placed in foster care, homeless individuals, and also had experience working in a psychiatric hospital emergency room where patients were hospitalized for their mental illness.
Wow. We understand that you've been doing this for the last 10 years and you focus more on enhancing services offered and providing education awareness. Can you please elaborate on that?
Sure. So this MedTalk actually is perfectly aligned with what my program is all about. And basically, it started about 10 years ago where the focus was really to bring in early intervention and prevention services to the community and get them aware of their mental health issue, make sure that they're aware of the mental health issues and that they can get treatment early on. And so our what we've done is that we've worked with doctors throughout LA County at public health centers. And we're currently within 8 different locations throughout LA County, working directly with doctors to help them identify patients that may have mental health symptoms, and then have them refer over to my team, which is a group of licensed clinical social workers and therapists who then provide short-term therapy to improve and address the mental health issues that the patient may be presenting with.
That's very fascinating. And then I read a little bit that right now you're currently supervising licensed clinicians and providing therapy to clients. What are some of the areas of focus that you're dealing with?
Right. So some of these, the patients that we see are the ones who are coping with anxiety, depression, maybe an adjustment to something that's happening in their life. More recently, of course, patients who are coping with COVID, the pandemic, just like all of us are.
That's fascinating. So now Stacy has prepared a short presentation going over some of the aspects of mental health, and she will be addressing some of the stigmas involved with mental health. And with that, I would like to turn over to Stacy so she could begin her presentation.
Thank you. Okay. Thank you everyone for being here and also sending in questions beforehand. I did do my best to try to answer most of them. But before we get started, I'd actually like to invite all of you to take a few deep breaths with me. So if you can breathe in through your nose and blow it out slowly through your mouth. Another breath in your nose and out your mouth. And one last one in your nose and out of your mouth. So I'm actually gonna stop my video, and I want to, my title here says mental health equals crazy. I want you to think about it and think whether this is a belief of yours or not. What I'll go through, next slide please. What I'll go through today is to talk about some myths and stigmas around mental health. And this is a very important step because we need to understand these in helping us understand what mental health really is and how any of us can have mental health issues. I'll also talk about coping strategies that we have been using, and maybe additional coping strategies that you may not be aware of, along with ways to recognize what some mental health symptoms may be, and then treatment options. And lastly, I'll leave you with some resources that are available for free. Next slide, please. Okay, I apologize for the delay. I'm just making sure that you guys can see the slides. Okay, so as I mentioned, there are stigmas about mental health that is important to address. And like Irving said, there's a lot of misconception, misinformation that is, spread. And so this, especially around mental health, it has been such a big issue that it affects one's willingness to accept treatment or even open up to somebody for the fear of being labeled as crazy. But having a mental illness just means that your body and mind is trying to cope with stressors in life. So regardless of our age, we all experience some sort of stressor, big or small. This could be stress over our grades, you know, maybe maybe a loss of a loved one, maybe dealing with a car accident or a global pandemic. And these are life challenges, but it does not mean that you're crazy. Another misconception is that mental health issues are a sign of weakness. Mental health issues are usually a result of complex mixture of trauma, stress, sometimes biological factors and environmental factors. Having mental health issues or an illness is not something that you should blame yourself for. Mental health issues can be prevented. A way to think about it is that, you know, just like someone who needs medical assistance to be treated for a severe physical injury, you may need some help to get better for a mental health concern. And as I mentioned, anyone is susceptible to experiencing mental health illness, and it affects people of all class, age, gender, ethnicity. A big misconception is that people who have mental illness are violent. And I think that has a lot to do with some fear and stigma around this, also particularly around the component of psychosis. But it's also, you know, in what you see in media, in film, and then also, you know, news stories that are sensationalized. But in reality, when we look at, you know, research, it shows that only about 7.5% of crimes are actually committed when someone who, by someone who is having mental health issues at that time. From my experience in working at a psychiatric emergency room, I've actually talked to patients who hear voices, and you know, they tell me that they hear voices telling them to hurt themselves, but they know that is wrong, and that, you know, they don't have intentions on hurting this person, and usually ask for help. And medication is usually what helps with this. Another big misconception about mental illness is bipolar disorder. You know, people diagnosed with bipolar disorder are moody, or you'll hear someone say, you know, she was so happy one minute and next thing you know, she's so upset. She must be bipolar. And, you know, this bipolar does have mood episodes, but it's not the same as being moody. Usually the symptoms are considered episodes because they have been occurring frequently, sometimes daily, and up to 1 to 2 weeks at a time, which is, you know, a depressed mood or an elevated mood, in order to be diagnosed with bipolar. Additionally, the symptoms usually impact their ability to function at work, at school, and it impacts their relationships with others. And lastly, there's a belief that psychiatric medications are bad for you. You know, there are people who take insulin when they're diabetic. So, you know, taking antidepressant is similar in that it's just helping somebody who's depressed feel better. So, you know, the misunderstanding and stigma surrounding mental health usually leads to unnecessary shame and isolation. And it makes the person who is going through, who's having symptoms of mental health feel worse. Sometimes it also makes them avoid treatment. So, you know, I want to take this time to also have us think twice about quickly judging someone and saying, you know, that this person is crazy, or using the word crazy, because you know, it can make them feel like they cannot reach out for help. Instead, what you can do is take a moment and say, how can I help you? And even though that you may not have an answer, just your support can mean a lot to one person who is experiencing mental health issues. Next slide, please. Okay, so is there a difference between mental health and mental illness? Yes, there is. Mental health is something that we all have in us. It's part of our emotional state, our well-being, how we feel about ourselves, and how we interact with each other. When we have good mental health, usually we're more resilient, we can handle life's challenges, we have meaningful relationships with others, and we can make sound decisions. We all have coping skills that we rely on to help us. For example, support of family and friends, exercising, journaling, deep breathing, praying, or eating food that you enjoy, whether you realize it or not. If some of you would like to think of ways that you've gotten through a stressful time, you can, jot down what some of these things you've been doing to get through it. On the other end, mental illness actually refers to a range of disorders that affect your mood, thinking, and behavior. And it's often that they also have a problem functioning at work, home, and in their social situations. Mental illness is an extension of our mental health. It refers to symptoms that are creating an imbalance in our emotional state and mood. And as I mentioned earlier about having a diagnosis of bipolar disorder, it means having symptoms that are chronic and it's functioning, it's impacting your functioning. Mental health is preventable, is a myth, because the misunderstanding that mental illness is something that a person can overcome with their willpower is, simply not true. Some mental illness can be caused by biological factors such as your genes, brain chemistry, substance use, trauma, abuse, or a family history of mental illness. It is, in a sense, preventable when we're getting worse, when we can remove stigma of seeking and receiving treatment. And contrary to beliefs, having a mental illness does not mean that it is untreatable and that the individual's life is not good. With treatment and support, someone with mental illness can sustain good mental health and learn the skills they need to cope with in stressful situations. Okay, next slide. Okay, a key part, I think, of understanding mental health is also understanding that, our thoughts, emotions, and behavior all impact one another, and that is how that will affect our overall mental health. Do you ever wonder how someone who is who might have gotten into an accident and now is wheelchair bound can still push themselves to be an active and happy person in their life? Well, let's look at, what I just mentioned in terms of thoughts, emotions, and behaviors. When you look at your thoughts, what you rethink about affects the way that we feel and act. Similarly, emotions, how we feel, will affect the way we think and what we do. And our behavior, what we do, affects how we think and feel. So for the person I mentioned who's wheelchair bound, having positive thought and outlook on life and a sense of confidence can influence his emotions, his behaviors, to follow through with physical therapy, or find a way. Let's say, he really enjoyed playing basketball before, finding a way to continue playing basketball despite his physical limitation. Okay, so that is a quick overview of what mental health is. Let's move to talking about what we may already be doing to maintain our mental health and how to recognize when one's own mental health might need some additional care and attention. Next slide, please. Okay, so self-care is how we take care of ourselves. Sometimes we do a good job at it. However, there are times when we may not, and that will affect our overall mental health. In the graphic you see here, there are different ways in which we can maintain emotional well-being or good mental health. And that's what this is what we do on a day-to-day basis. We take care of ourselves by eating well, sleeping well. We, family or friends, we have conversations with them. We keep connected with them. We also, continue to foster positive relationships by engaging with other people in a good way, positive way. And then we relax by being active. Some people like to exercise, others like to meditate, some pray, some sing, some dance. And then the last step is knowing the 5 signs of emotional well-being, which is what I'll go into some more in the next slide. But before we go there, in the field of mental health, usually clinicians will take a day off of work using our, sick time, personal time, but we'll say that we're taking a mental health day. And that is absolutely acceptable and free of judgment. However, it's not just something that we can use in the field. It can be used by anybody else. Any of us can put up a white flag and say, I need a mental health day today. And that's okay, because that means you're gonna focus on some self-care and make sure that you can bring yourself back to good mental health. Okay, next slide, please. Thank you. So what are some signs to pay attention to when, to let you know that, you may be experiencing some mental health issue? But before we start talking about recognizing when we're experiencing mental health issues, just a reminder to all of us that we all experience mental health difficulties in our life and respond to them differently. While, we've all experienced some of the symptoms that I'm going to review, that does not translate into having a mental illness. It does not mean that you're weak. What it means is that your body and mind is finding a way to fight the stress. So these are 5 general signs that you or someone close to you might recognize as, and point out to you. The first one is personality change. So this is something that's just uncharacteristic presentation of yourself. If you tend to be more of a happy, easygoing person, but more lately you've been irritable and snappy, that's a personality change. Some agitation. So similar to what I just mentioned, it's just, anger or anxiety or moodiness, irritability that just, been happening more than usual. Or if you're withdrawn, isolating yourself at home, not going to social events, isolating from your family and friends because, you're not feeling well. And then the other thing is poor self-care. What that means is, you're not sleeping as well, you're not eating or taking a shower daily like you used to. And then the last one is feeling hopeless, which is usually characterized by overwhelming feelings and sometimes having thoughts of suicide or being better off dead. Having any of these symptoms or more than one of the symptoms is a signal to you that you should take care of your mental health and that you need to do some self-care. Next slide.
Definitely, if I could chime in real fast.
Yeah.
One of the things that clinicians or physicians look for in patients is that we look for signs of their ability to carry out routines of daily functions. So if we notice that that has been declining, or if we hear that from a loved one, that's something that we keep in the back of our mind, that we've noticed that this person is not able to carry out their daily functions anymore. So we keep that in our mind while we probe and we try to determine what is going on with the person. So that's a really good point that Stacy made.
Yeah, and thank you for bringing that up, because those are things that we listen for to help us understand like to help us see where the changes may be and where we might need to provide additional support. Okay, anything else? Okay, so next part is talking about how we can maintain our mental health. Like I mentioned earlier, some people, we're already doing some of these on an ongoing basis. And coping strategies, coping activities is referring to ways that we release stress. So some of us may, like I said, may enjoy exercising. There's people who like doing baking therapy, going for a walk. And like Lynn mentioned earlier, I like doing color therapy. I like listening to different types of music. These are the things that kind of help me when I'm feeling a little bit stressed and there's a lot going on. So I take a few minutes to do these things. And there's also pleasurable activities that we might look at. At the end of the talk, Lynn will actually provide a resource sheet that I put together with links to different topics. And one of the links that I'm providing is to a list of pleasurable activities that you can look at and pick and choose what you would like to do, what you would find pleasurable, and you do what's within your mean, both financially and physically. And some of these activities can be big. Some people might say, I want to go off and travel for a whole week, and if they can, that's their way of maintaining the mental health. That's perfectly fine. But there's also little activities you can do that are okay as well, such as focusing on someone else and maybe giving someone else a compliment, or giving yourself 5 minutes to cry, and that's okay too. A big, I think, way of maintaining your mental health also is to get support from your family, your friends, your community. We are all not in the, even though you may be experiencing the mental health symptoms, you're not alone. Support is always gonna be one of your best way of getting better. And so, someone asked the question of like, well, what step can someone take if they're feeling embarrassed about their mental health issues? And this is where support will come in very handy. You find someone that you talk to, that you can trust and confide in, or even somebody that you feel is not gonna, judge you for sharing your thoughts and your symptoms. Sometimes that may even be, your pastor or a counselor at school, or some people go to their primary care doctor and they will say, I just have so much stress going on at home and these are the things that are happening to me. And like Dr. Thing was just saying that, they listen for these things to find, to hear like where can they provide the support. So, If any of you have a Post-it nearby or a piece of paper, I invite you to quickly jot down up to possibly 5 names of people that you would reach out to support. And you keep this near you, keep it in your wallet. Anytime you feel like things are too stressful, you pull this list out and you call any one of those people on the list to talk to. I have this myself. I actually just looked at it the other day, and the title I put on it is it's my Get Well team. So I invite you to do that either now or a little bit later. But it's certainly a good way to remind yourself that you have support. And then another way to maintain your mental health is something called sleep hygiene. Sleep hygiene refers to, making sure that you recognize your body's need for sleep, getting enough sleep. We hear this a lot, that people say you should make sure you get between 6, 7, 8 hours of sleep every night. And with if we don't get enough sleep, poor sleep will actually affect our mental health as well. Sometimes what it will do is it'll affect your concentration at school or work. It will affect your mood and make you more irritable. And it can also affect your relationships with other people. Next slide. Okay, so this will be in the resource sheet so that you can look at it bigger as well, or print out for yourself. But this is a nice handy poster about things that you can do prior to sleep to make sure that when you go to sleep, you're gonna have a good rest. Something that sometimes we don't think about is making sure that we don't drink too much prior to going to bed, especially caffeine. Another thing is to make sure that our room is comfortable, whether if it's too hot or too cold, we're not going to be able to fall asleep and have good sleep. And then there are also those of us who may find ourselves waking up in the middle of the night and not being able to fall back asleep. And I believe this is one of the questions that was sent in too. Well, what do you do? So, suggestions have been that when you do wake up and you can't fall asleep after 20 minutes, you should actually get out of bed and do something boring. Maybe listen to some calming music or read something, and then until you're tired again, and then go back to sleep. Okay, next slide, please. All right. So now I am going to talk about, when is the right time to reach out for help. So we just talked about some coping strategies that we, can do. And then I shared with you a tip of having a list of support people nearby. But sometimes, you might need a little bit more than that. And so, as I mentioned earlier in my program, we work with doctors to identify individuals who may be having some mental health issues and may need help to get them back to, a good mental health well-being. And so treatment of mental health or mental illness can include therapy, can include medication, or both. Sometimes therapy alone can be okay for someone who's experiencing a little bit of symptoms. This allows you to talk about your stressors, but also gives you a chance to look at what coping skills you have used and maybe practicing some new coping skills. A therapist can also help you look at how your thoughts may be affecting your emotions and behaviors, and teach you ways of changing your thoughts. Therapy can be short-term with a couple sessions, or it can be longer term for those whose symptoms may be a little bit more severe. Medication alone can also work for some, and that's usually, you would get that from the doctor or a psychiatrist. But what we've seen is that therapy and medication together for certain individuals actually works best. And, in working with both the doctor and the therapist together, they're able to monitor the effectiveness of their respective treatments. So for anybody who is in need of, therapy or medication, you can talk to your primary care doctor. This is the one that you go to for your annual physical or your vaccinations, and you let them know how you're feeling and that you want to refer to talk to a therapist. Usually your insurance card, if you have it, and on the back side, there would be an 800 number, and it would say behavioral health, and that's what it means in terms of connecting to a therapist. You also have the option of calling the helpline, which is the Department of Mental Health hotline that we have that's available 24 hours, 7 days a week. And you can ask for information about a mental health clinic that is nearby, and you can go there if you choose to go directly there versus working with your primary care doctor. For those who may be experiencing, more severe symptoms, having psychosis, hearing things or seeing things, or maybe feeling really down and having thoughts of wanting to hurt someone or yourself, sometimes that may require a hospital visit so that the treatment interventions can be provided, which includes, sometimes medication and a safe environment to be monitored. If, there was a question of, well, what if somebody is feeling suicidal at the moment? What can I do? 911 is always an option, especially if they're going to act on it right away. If they're saying that they would like to act on, they have a suicide plan, then you can always bring them to the nearest emergency room for an evaluation. And if needed, then a psychiatric hospitalization can be facilitated. And then we also have there is also a national suicide prevention hotline for someone who may be having these thoughts and want to reach out to somebody to talk to. There's a 800 number for that, which will also be listed in the resource sheet as well. I think the important thing is that, hearing about suicide, talking about suicide can be scary. And if you, talk to someone who is expressing having suicidal thoughts and ideas, then, the best thing you can do is to offer support. We don't want to say anything like, no, you don't really mean that, or, hey, snap out of it. Saying those things can be really stigmatizing, and it can actually prevent this person from seeking help when they need to. So, just remember that mental health illness and issues are treatable. Okay, next slide, please. So I'm going to share some resources that are available. And again, this will also be in the handout. I mentioned the Los Angeles County Helpline that is available 24/7. They did expand it to offer texting as well, a crisis text line, where you can text LA to 741-741, and you'll be connected to a trained counselor. And additionally, with the COVID-19 pandemic and the increase of people experiencing, you know, difficulty, having anxiety or depression about all the changes we've gone through in the last couple months, there is a something called an emotional support warm line that is also available under this 800 number, which is option 2, where you can talk to somebody about your stress and anxiety related to COVID-19. Next slide. Okay, this one, additional resources. These 2 resources are free at this and available to everyone here. Headspace, the first one with the orange circle icon, it can be downloaded on your iPhone or your cell phone, and it's currently free to all Los Angeles County residents until December 31st, at the end of this year. It offers meditations for all different levels and durations. So if it's your first time, some meditations may start at, you know, 1 minute, 3 minutes or so, and then it increases as you get comfortable with it. It also offers sleep stories, wind downs, calming music. So some of this, you know, can be used to facilitate falling asleep or going back to sleep when in the middle of the night. And then there's also workouts for those who want stress and anxiety relief. Another app that's also free is the UCLA Mindfulness app. And there is no time limit on this, but this one is limited to meditations. Okay, next slide, please. Okay, and this are for any of you who has an Instagram account. I pulled out some accounts that focuses on positive thinking, which goes a long way with helping us maintain our mental health. So here's a few example. It's okay not to be okay. Sometimes I forget that worrying doesn't actually do anything. When I see this, you know, it's such a good reminder that, you know, our thoughts aren't necessarily the fact, and it doesn't change what's going on around us. So it's a good reminder to really focus on, you know, having positive thoughts, a positive outlook. And then the other thing, this account, Positively Present, offers a lot of different posts about, you know, little things that you can do when you have a stressful day, and just, you know, suggestions that you can pull from. And Good News Movement is actually like different stories about good things that are happening, you know, around the world, with a lot of negative stories in media and negative events that's been happening. It can be very overwhelming and tiring. So, you know, sometimes just watching or hearing a story about somebody who did a good deed can improve your mood. Okay, next slide, please. So that comes to the end of my talk. I hope that you learned about mental health issues and mental illness and know the difference. And, you know, just a reminder for you that you have to take care of yourself and take care of your loved ones.
All right, Stacy, thank you very much for that presentation. You made a lot of very good points. One thing I would like to discuss a little bit more with you, if you don't mind, is can we discuss medication involved in treating mental health disorders.
Okay.
I would definitely like to point out that, yeah, there definitely is a stigma. People just view it as, oh, you're taking crazy pills, or
Mm-hmm.
they may have a stigma that a doctor's just going to throw them some pills and forget about them.
Right.
Could you chime in on your experience in, helping patients with therapy and the medication? Because I believe that, there has been research to be shown that therapy and medication is definitely more effective than either alone for a wide range of the mental health disorders.
Right. Yeah. And, that's part of why my program really focuses on working closely with the doctor. What we do is the therapist, because they see a client more frequently, maybe every 2 weeks for sessions, they're able to check in with the client, like, how are you doing with this medication? Do you feel like it's working for you or not? And if there are any side effects, then that information can get relayed to the doctor who prescribed it, and then the doctor can make the adjustment that's needed. And so it's a team effort in taking care of this one client together. And definitely not, like you said, patients may feel like they're being abandoned, but when you have a therapist and a doctor working together, then you have more opportunities to really work on your well-being.
Absolutely. And
Yeah.
I think that's one of the more modern approaches to medicine, and also what's being taught in medical school, that medical students, when they leave to enter residency, or when they open up and become fully licensed doctors, they are working as part of a team, and that team can involve the nurses, pharmacists, therapists, any other specialized role. It's being taught that we're supposed to be working as a team together.
Right.
And I think that's really beneficial. One thing I think that, if anyone has dealt with a doctor that they felt is not providing them with adequate services, I just want to make it mention that you as a patient have certain rights. You as a patient has the right to be seen by a doctor that will listen to your concerns and will address your concerns. If at any point you feel that your doctor is not meeting those needs, you have the right to go find another doctor that will. And I think that's the most important thing, is to recognize when your needs are not being met by a doctor, and to seek someone else that will address your needs.
That's a good point.
And then I think with that, we had a lot of questions submitted for the program, and I think it would be good to go over a few of those questions
Sure.
with you while we still have you, Stacy.
Yeah, absolutely.
So during the presentation, and one of the questions, someone asked about proper sleep hygiene. Could you dive into that a little deeper about what constitutes good sleep hygiene?
Sure. So, I mentioned not drinking liquid, especially caffeine, a couple hours before your bedtime. And your bedtime means, the time that you are gonna schedule yourself to go to sleep. So it should be consistent. That's part of sleep hygiene. You should try to be consistent every day with setting a bedtime and waking up at a certain time. So, if you know that you're going to be going to sleep at 10, try not to drink anything after dinner. If people, get thirsty, obviously a little bit is okay, but you just don't want to make it so that your body's going to wake you up, and you have to go to the bathroom, and that's going to disturb your sleep, right?
Definitely.
Yeah. And then the difficult thing is, a lot of us are really attached to our iPhones, our cell phones, and like to go to sleep, going through stuff, watching movies. But sometimes that can actually affect your ability to fall asleep afterwards, because, maybe you're watching something that is anxiety provoking or maybe exciting, and then you turn it off and you try to go to sleep, your body's still very activated. Same thing, exercise. Like, you don't want to exercise right before going to sleep. That's not calming. So doing other activities that are more calming prior to bedtime. So yeah, those are important. The one thing to add to it too is, if you can, make sure that your bed is only used for sleep, and that is not used for other things like working on or other activities, because you want to make sure that you safeguard that space. And once your body lays down, it knows that, okay, I'm supposed to go to sleep here.
Absolutely. Those
Yeah.
are all important things to do. And I think a lot of us definitely kind of break some of those rules.
Yeah.
One thing I wanted to discuss a little bit more, since I feel it's one of the most prevalent mental health issues, is anxiety. About 40 million adults deal with anxiety. So it's a very common problem. And
Right.
some of the things that people ask, they wanted to know, what are, let me ask you, what are some of the most effective things that you've seen for people to be able to deal with their anxiety in terms of whether it's getting therapy or medication?
Certainly with therapy, because that's my field. I've seen improvements with clients in that, when they first come in, they may be extremely anxious, shaky, nervous. And after attending a few sessions of therapy and just learning different techniques like deep breathing, similar to what we did earlier, practicing relaxation or practicing ways to stop our anxiety provoking thoughts, can really change the way a person handles their anxiety. On the resource list, I listed two techniques of dealing with anxiety. One is called a grounding technique, which really, you can take this anywhere with you, but anytime you're feeling super anxious, and you feel like you've lost control of what's going on around you, this technique will sort of bring you back to, okay, I'm here in the present. Let me focus on what's around me and pay attention to that. And basically what it does is that it takes your mind off of your overwhelmed feeling, and it kind of brings you back down.
Right.
Mm-hmm.
And then in terms of medication, I know that one of our viewers sent in a question. They wanted to know, when do doctors turn to medication as a treatment option? And that's a fairly complex answer, but I would like to hear from your viewpoint.
Yeah. I think I won't have a right answer to this because I'm not the doctor prescribing, but primary care doctors, they have their education about this area, and so obviously, if they feel that the medication might help with a certain symptom, like let's say if a person's saying I have insomnia, I can't go to sleep at night, and the doctor wants to bring down the anxiety level, they might prescribe a medication to kind of see if that will help with it or not. And then if that improves, then they depending on the outcome, the doctor might continue it, or they might also recommend therapy to say, hey, in addition to this medication, I think you should also learn different ways to cope with your anxiety that's keeping you up at night.
Definitely.
Yeah.
And then on the flip side, what about people that come in and insist on medication and kind of refuse therapy? How do you approach those situations?
Well, so from our end, there's what we can do is just provide education. There might be a stigma around it, and so it's just being available to meet with the person, answer any questions they may have about medication in conjunction with the doctor. The doctor can explain the medication questions, and then the therapist can say, if you're concerned about therapy and what that means, this is what we can offer, and this is how I can help you. So we hope we would just work with the person and support them and provide education until they're comfortable. If they're not comfortable, then we just hope that down the line, if they change their mind and they want to try therapy, then they know it's available to them. But we know that it's not for everybody. So.
Absolutely, and that's one of the things that's most challenging, is that sometimes people just aren't ready for help. And the best thing we can do is just let them know that even if you're not ready, when you are ready, we will be here to help you.
Right.
And with that, Stacy, I know we're running up to the time limit of when you have to leave. Is there anything else you would like to share with the audience before you have to go?
Yeah, I really want to thank everyone for being here. I think that just the topic of mental health itself can be scary because of all the stigma around it. So I was really glad to hear that we had so many interested people. I hope that this was helpful for you. And just want to leave you with, make sure you take care of yourself, take care of those around you, and yeah, thank you for taking this time.
Well, thank you
you,
very much, Stacy.
Stacy.
You're welcome.
And
Stacy, we'll let you go because I know you have to run.
Okay.
So I would like to tell everybody that if you guys do have questions, you can send me an email or the list of resources that I did include. I will link that again. Definitely take advantage of the resources because they're there for you. They're free. They're there to help you. So I do have another person that I did invite, so I'll have her speak for a moment. But Stacy, thank you again for being here and for being with all of us. We appreciate you so much, and we wish you all the best and keep doing what you're doing.
Thank you. Thank you. You too.
thank you so much, Stacy. Really appreciate you coming on.
Yeah. Bye.
Bye, Stacy. So everybody, if you're still here, thank you so much for sticking with us. I do have a very good friend of mine that is here. Her name is Sarah. Sarah Schufel. She is with Teen Line Online. I'm going to go ahead and unmute her. I would love for her to just share a little bit about what Teen Line Online is. So that way, you guys know that you have another resource, especially for all of the amazing teens out there.
Yes, thank you so much, Lynn. Hi, everybody, and thanks for sticking around for this last little bit of info. Yeah, Teen Line's a really amazing resource if you are working with teens and young people. We are a peer-to-peer hotline, so all of our volunteers are between the ages typically of 15 and 18 years old. That means, of course, that if you work with teens, there's opportunities for them to get involved as well. Since COVID, we've had a lot of different changes in the types of contact we're receiving and the level of contact we receive via text and phone calls. So if you have questions about that, I can obviously go into more detail on what that means exactly. But yes, for your general information, I'll send an attachment in this chat box as well of how to get in contact with us. But we are open nightly from 6 to 10 p.m. on our hotline and 6 to 9 p.m. via text. We have an online message board and so many ways to get in contact. And also, I do all the outreach. Lynn can definitely answer any questions about that. I've worked with teens from Palisades branch. But if you have questions or want to have some mental health conversations with the teens that you work with, you can definitely reach out to me and we can schedule something together. So I will share in the chat that information. And if you have any questions, I'm absolutely happy to answer them.
All right. So thank you so much, Sarah. And again, thank you everybody for being with us today. We are just so excited that there's been such a huge interest on mental health, and we'd love to highlight that our next program, it's going to be in the next 2 weeks. We're going to be covering the topic of diets and nutrition. So if you've already signed up for our sign-up sheet, you will get that email. And I will send everybody another email on attachment of resources and the surveys after this if you didn't get that in the chat box. So yeah, this will conclude our program. And if anybody has any questions, I'm going to stick around for the next 5 minutes. And you're welcome to, yeah, not just the hotline. You're welcome to hang out with me, ask questions if you'd like. I wish you guys all a wonderful day. Thank you for coming again, and I hope that you found the information insightful. The survey is linked there, so please do help us fill out the survey. Thanks, everybody. Thank you, Sarah, for being here with us. I know it's so last minute. Thank you, guys.
My pleasure. Thank you.
Yeah. And then, let me go ahead. I know Irving is having a little bit of issues. There we go.
Hi, sorry. My
Oops. Irving, you're still here. Yes.
Okay, sorry, I'm having some technical difficulties. But for the people that are still here, I can go over and answer a few questions that were submitted before the program.
Yeah.
Yeah, I wanted to mention that earlier, but my thing froze and a bunch of people left before. I apologize for those technical difficulties.
Yeah.
So one of the things that people asked was, how can I recognize a mental illness in me or others and seek help? I think that's really good to discuss really quickly. I think Stacy did go over it, but I wanted to elaborate a little bit more on that. So the main thing that you can look in is, has your, like I mentioned before, has your ability to function been impaired? Are you not able to do the things that you used to do? That's one of the key things that we look for as a doctor. So these are some things you could ask yourself, or if you see it in someone that you're concerned about, these are the things to look for, such as difficulty concentrating, emotional outbursts, invasive, decreased energy or fatigue, changes in eating habits, changes in sleep habits, and also social withdrawal from friends and family. These are all some warning signs of possible mental illness, and this is the time to approach that person, or to ask yourself, do I need help? And if you know someone going through this, the most important thing is to encourage communication. Let them know that you are willing to be here to help them and to listen to them. Now, it's important to not try to tackle this yourself. Definitely encourage them to seek out some kind of professional help. It can really be a big task to try to do this by yourself with your friend. And one thing that I must strongly encourage, if a friend has concerns about their mental health, and they make you a promise, they make you promise to keep it a secret, I would recommend against doing that, because it could get to the point where they may want to harm themselves or someone else. At that point, if you've already made a promise to keep it a secret, now you're in a bind. If you break that promise, they may never trust you again in case something happens in the future. If you don't do anything, something bad could happen. So if you're ever put in this difficult situation where someone wants you to promise to keep a thing a secret, tell them that you cannot make that promise, but you will be there for them, and that you will be there to help them through whatever they're going through. And let them know that you cannot make this promise for that reason that I just mentioned. In case they decide to harm themselves or someone else, those are the reasons why you should not keep that promise. Another question I had was on autism, and someone asked, what is autism specifically? And what are some ways to help if I know someone that suffers from autism? Autism, it's an issue with development mainly. It's an abnormal or impaired social interaction, and it usually involves communication, usually before the age of 3. In mild cases, speech could be normal, but oftentimes it's delayed or absent. And the thing with autism is that people with autism, they have an insistence on a routine. So if um, if you know someone that's autistic, I'm sure you've seen them like stick to a certain routine. Any kind of deviation from that routine can cause significant distress. Some of the ways to identify autism early on in a toddler, for example, is poor eye contact and poor recognition of facial cues and emotional cues. Um, and so some of the things to know is that people with autism, they have these interests that are restricted and hyper focused. Another way to identify possible autism is that they have these stereotypical behaviors or speech. Now, what that means is that they have these repetitive speech or behavioral patterns, and these are just some of the things that may help you recognize someone with autism. Let me see. Another important thing I wanted to discuss real quickly is anxiety, since I know anxiety can be severely debilitating, and so many people deal with it. I think roughly 40 million people deal with anxiety. Um, with anxiety, as Stacy mentioned, it is important to identify certain triggers and also to identify what is it that you're anxious about. A lot of times people kind of confuse anxiety versus social phobias, and there are some key features that distinguish the two. Um, and with anxiety, I also want to mention, it's important to get help because it can be debilitating in your daily function. And medication does have an important role to play with anxiety because anxiety will actually affect uh, physiologic processes in the body. It can actually raise your levels of norepinephrine, epinephrine. It can cause physical changes such as elevated heart rate. It can cause difficulty concentration, all that stuff. So there is a role to play. There is a role for medication to play in the treatment of anxiety and other mental illnesses. Let me see here. Are there any other questions that you feel that you can answer?
I think most of if there's any other questions, I know there's still a few people left here. Again, Irving is a recent med school graduate, so he does have some experience in, working with patients. And we're just hoping to shed some light on if you do have like any questions that you need answers to, we can do our best to answer it. Otherwise, we can just wrap up. Let everybody go on their way. Yeah, the chat box is there for you guys, so we're here. Again, like I mentioned, we're going to hang out for the next couple minutes, but if anybody has questions, please do feel free to type that in the chat box. Oh, okay, Pamela, what are your thoughts on BetterHelp?
BetterHelp, can you please elaborate on that? Because I'm not exactly sure what you mean by BetterHelp. Are you referring to BetterHelp from the physician standpoint?
I'm pretty sure she's typing it up. She's usually really good.
This is okay. It's okay.
Yeah. Okay. Oh, it's an online therapy e-counseling platform. Wow, I didn't even know that.
Yeah, I haven't actually heard about that. But I do feel that, with the advent of telemedicine, I do feel like online therapy programs such as BetterHelp, it definitely could provide a useful resource, and maybe in terms of initial contact with someone or getting the initial steps of recovery or help. I think those could definitely solve a need. Now, in terms of whether I feel that it's good to, or whether I feel it's going to replace actual person-to-person interaction, I don't think it's going to be able to do that. I think that's one of the limits of online platforms or telemedicine. I think the person-to-person interaction, sitting next to a therapist or doctor when you need to, I think that still provides a certain touch that telemedicine or online platforms can't provide. But I definitely think it does have its uses, and I think that healthcare professionals definitely need to embrace all the new technologies that are coming out to make treatment even better. Because for sure, we're not perfect, and treatment is not perfect, and there's always ways to improve.
I hope that answers your question, Pamela.
And does anyone have any other questions that I could try to answer in this time?
I think you're doing pretty good. It's just a lot of people hanging out.
Okay.
Oh, will recording be available? Yes. So I'm gonna do my best to. I am recording this, and I'm going to contact our PR person and hopefully get this available onto our YouTube page for Los Angeles Public Library. Yeah, we just have to add captions to it, and that's why it's taking so long, just to meet the ADA requirements. Thank you, Yigi. I'll make sure you fill out the volunteer form for me, okay? I want to make sure I give everybody community service hours if you're a teen.
Thank you everyone for coming to the program. And
Yeah.
just a reminder, you know, 1 in 5 Americans deal with mental health every year. So if you or someone you know is going through it, just know you're not alone. There's so many other people that are going through it too. And take that first step to find help, you know, because it will definitely, you know, you shouldn't have to deal with this by yourself and lead a restricted lifestyle due to this.
Yeah. All right. So I'm going to go ahead. I'm going to conclude the recording here. Thank you, everybody, for being with us today. We'll see you in 2 weeks. I'll send you an email. Our next topic for MedTalks is going to be diets and nutrition.